Hi friends, let us talk today about prevention of congenital anomalies. Is it possible to prevent congenital anomalies? Yes. There are 5 levels of prevention as we learn in the preventive and social medicine. Health promotion, specific protection, early diagnosis and treatment, disability limitation and rehabilitation. These are the 5 stages of prevention. Let us talk about health promotion. How we can promote health of pregnant women. First of all, whenever possible, consanguineous marriages should be avoided. Also, whenever possible, late marriages and late conception after 35 years of age, if possible, should be avoided. In girls, anemia and malnutrition should be prevented by providing proper diet. Encourage immunization of all the female children, especially MMR vaccine, because rubella can cause congenital anomalies if acquired during pregnancy. We must encourage balanced diet in women trying to conceive. Especially, they must include foods which contain proper quantity of folic acid, multivitamins, other vitamins, and proteins when they are contemplating pregnancy. Then the next level is specific protection. If a woman is planning to undertake pregnancy, then if she is having some applying some ointment for skin problems like acne, which contains high doses of vitamin A. Friends, high doses of vitamin A are they teratogen, so they can produce anomalies. So if a woman is contemplating pregnancy, 3 months before trying for pregnancy, she must stop these medicines containing high doses of vitamin A ointment form acne. Then, if the woman is antihypertensive, anti-diabetic or anti-epileptic drug, the physician must change the brand to the drug which is pregnancy friendly, that is more safe in pregnancy. So the drug should be changed. For example, if blood pressure is high, then she is taking some other drug, then safe medicine like labetalol or nifedipine is preferred to be started before conceiving. We must encourage intake of 5 milligram folic acid tablet and multivitamins when a woman is trying to conceive, and this should be continued in the first 3 months of pregnancy also. If a woman is diabetic, then the tight control of diabetes, that is blood sugar control, is essential to minimize the chances of development of congenital anomalies which are otherwise very high. If the diabetes is uncontrolled, the chances of developing anomalies are very high. If a woman is consuming tobacco in any form, whether chewing, smoking, active smoking or passive smoking, whatever form, that should be avoided. Exposure to X-rays, intake of alcohol and intake of certain drugs without consultation of doctor in the first 3 months of pregnancy should be avoided. Also, avoid getting infections like upper respiratory tract infections in the first trimester of pregnancy. Let us now talk about early diagnosis and treatment. So, as I have talked in my earlier videos, we must encourage first trimester screening, including anti-scan at 11 to 13.6 weeks and serum biochemistry, preferably NIPT or at least double marker test to suspect a chromosomal abnormality like Down syndrome. If the woman is first trimester screen positive, the high risk of cases of chromosomal abnormality, then we offer them a CVS or amniocentesis, a definitive test to exclude the chromosomal abnormality. Anomaly scan at 18 to 22 weeks, which we have discussed, is to look for the structural anomalies and soft markers for chromosomal abnormality. And fetal 2D echo at 22 to 23 weeks, especially in those cases which are high risk for congenital heart anomaly. If the cases of anomaly or chromosomal defect are confirmed, then we provide proper counseling by a multidisciplinary team and help in decision making in a non-directive manner. Counseling is done for the couple also about the recurrence risk of a index disorder detected in the index pregnancy. If a couple decides to continue with pregnancy, then we might advise them to perform ultrasonography more frequently, especially if the mother is having diabetes or develops preeclampsia or fetal growth restriction. In such cases, when the pregnancy is continued, the delivery should be planned in a tertiary care center where all the facilities to receive the newborn is available. For example, the new fetus is suspected to have congenital diaphragmatic hernia. This delivery should take place in a tertiary care center where all the facilities are available in case the baby requires ventilation, oxygenation, or other forms of life support after birth or even surgery as soon as possible. Also, when such a child with congenital anomaly is born, must be assessed by pediatrician, pediatric surgeon, orthopedician, cardiologist, depending upon the anomaly present in the newborn. Plan out the proper optimal newborn care. For example, if the baby is suffering from cleft lip, cleft palate, then proper feeding techniques should be taught or should be followed so that aspiration of milk and the complications are avoided. Such a baby should be taken care not only by mother but proper nursing care in the form of support by nurses is also very essential to be provided. The next level is disability limitation in the newborn. Suppose a newborn is having clubfoot, congenital talipes equinovirus. Then timely treatment in the form of plaster cast or massage, all this should be provided so that the limitation of disability should be possible goal. Then rehabilitation. Suppose the child has undergone surgery for suppose some anomaly or some indication. Then after surgery, rehabilitation of the child is very important. If the child is undergone surgery for cleft lip, cleft palate, then speech therapy is one thing which is helpful for rehabilitating the child. Also, when such a couple is contemplating pregnancy in the next time, then we also provide them with the knowledge about recurrence risk of the condition so that proper take care can be taken in future pregnancy. So for other videos related to this topic like limitations of anomaly scan, frequently asked questions, pre and post test counseling, please refer to my other videos on YouTube channel. Thank you. Hope to see you soon again.